Dear friends, welcome to Know Thyself YouTube channel. Good morning. Hope you're all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we spoke about the nature and types of speech sound disorder. In this episode, we briefly analyze their causes, diagnosis, and treatment. Causes of speech sound disorder. Though there is no known cause of speech sound disorder, there are a number of factors that may increase the odds of a person developing speech sound disorder. Some of these risk factors are the following. First, gender. Males are more likely to develop speech sound disorder than females. Second, genetics and family history. Persons who have their family members living with speech sound disorder have greater risk of acquiring this disorder. Third, socio-economic conditions. Being raised in a low socio-economic environment may contribute to the development of speech sound disorder. Fourth, prenatal and postnatal challenges. Prenatal difficulties such as maternal infections and stressors may worsen the chances of speech sound disorders in a child. Similarly, postnatal conditions such as delivery complications, premature birth, and low birth weight could lead to speech sound disorders. Fifth, disabilities such as Down syndrome, autism, and other similar disabilities may be linked to the development of speech sound disorder. Sixth, physical structural anomalies like cleft lip, cleft palate, hearing impairment, and problems in the facial muscular structure leading to difficulties in chewing, maintaining a closed mouth, and blowing one's nose may lead to the origin of speech sound disorders. Seventh, brain damage caused by an infection or trauma to a child and other neurodevelopmental problems related to the brain can lead to speech sound disorders such as apraxia, in which the brain does not deliver correct movement instructions to the target muscles, and cerebral palsy, in which the muscles affecting speech are injured. Diagnosis of speech sound disorder. Diagnosis of speech sound disorder involves the speech language pathologist determining a person, whether child or an adult, has a speech sound disorder. Usually, diagnosis begins with an oral mechanism examination by an ENT specialist, which consists in evaluating the structure and functioning of the speech organs such as mouth, throat, ears, palate, lips, jaw, tongue, velum, and other related organs, so as to assess if the system is adequate for speech sound production and articulation. Having determined the physical condition of the affected person, the speech language pathologist will make a comprehensive assessment which calls for developing a case history of the affected person with the help of different screenings, tests, and assessments. Based on the comprehensive assessment, a speech sound pathologist could determine the nature, type, severity, and the impact of the disorder in the social, academic, and work life of the affected person in the light of the following diagnostic criteria. Firstly, the affected person experiences persistent difficulty with speech sound production, affecting speech sound comprehension and communication. Secondly, symptoms of speech sound disorder appear early during the person's developmental stages. Thirdly, the disorder limits communication, affects social interactions, academic achievements, and job performance. Finally, the speech sound disorder is not caused by other conditions like a congenital disorder or an acquired condition like hearing loss. In the light of these guidelines, a speech language pathologist would be able to diagnose and determine the nature and quality of the speech sound disorder and propose a treatment plan specific to the condition of the person. Treatment of speech sound disorder. Treatment for speech sound disorder primarily consists in speech and language therapy. With the help of therapy, a speech language pathologist helps the affected person, whether a child or an adult, to identify and correct specific speech sounds they have difficulty in producing and articulating. He may show the affected person how to move their tongues and lips to produce speech sounds correctly and provide opportunities to practice these skills. Concretely, it would imply providing a target of speech sounds the patient has difficulty with to work on reliably, working up from syllables to words to sentences, and finally stabilizing the speech sound production to the point where the patient is able to self-monitor and self-correct. Besides helping the patients with the production and articulation of speech sounds through speech language therapy, the speech language pathologist also may use non-speech oral motor exercises such as blowing, oral massage and brushing, cheek puffing, whistle blowing and the like to strengthen weak muscles of the speech organs, to enhance production and articulation of speech sounds, and as a help to learn the common ways of communicating. With this twofold approach of learning speech language skills and strengthening the weak oral organs, the persons affected by speech sound disorder respond well to the therapy and the speech difficulties improve over time. Nearly 75% of children with speech sound disorder improve their condition by age 6. In dealing with children with speech sound disorder during treatment period, the parents and guardians must avoid showing excessive concern as it can cause unwanted strain on the child. Instead, they must listen patiently to the needs of their children with this disorder and help them complete what is demanded of them during therapy with genuine understanding and kindness. Parents are also advised to join support groups along with their children for getting the needed information and assistance to deal with this disorder during treatment. In the next episode, we will take up for consideration the second communication disorder, namely language disorder or LD in detail. Thank you for watching this video. Stay blessed until we see you again with another video.